So, dental implant is nothing but a titanium screw. A screw that is very well designed, very well planned, and specially coated on top of it, the threads, as you can see, that allows integration or fixing into the bone over the years. Typically, a dental implant will take 6 months to integrate properly with the bone. That is why, routinely, we would place a dental implant, wait for a few months before we go into the next phase of restoration. Dental implants are fixed to the bone, in contrast to teeth, which are suspended in the bone. So that's another important factor to remember. Your natural tooth is still better than a dental implant. Of course, sometimes as the situation develops and you lose a tooth, then in that case, dental implant is a good solution. We do come across situations where patients think that dental implants are better than their natural teeth. That is not the case. So it's never a good idea to just rush into considering dental implants while your teeth are restorable and can be protected and their life can be prolonged. Different types of systems. There are many dental implant systems that are available in the market. We tend to use premier dental implant systems. For example, BioHorizons. They have specific methods, patented technology into their implant systems. For example, laser lock, which gives a better soft tissue profile and attachment to the implant. Dental implants can be provided for a single missing tooth. So for example, that's a single tooth with a dental implant and a crown on top, or for multiple teeth. If you've got a few teeth missing, a dental implant, two dental implants are placed, and then a bridge is supported onto that. This is another example of that. So we can see two dental implants in the bone and then a bridge, which is a texture, something like this, that will go on top of the abutments of the implants and give us a nice restoration. They do require extra maintenance and care, something that is discussed usually as we follow up with the treatments. The other option is for those patients who have severe gum disease or have had extreme dental disease over the years, resulting in injury, trauma, or loss of teeth because of the trauma or injury, complete loss of teeth. Those patients can have now a very successful treatment option where we can place 3 or 4 implants to support a fixed bridge, and that can be done usually on an immediate basis. This concept is classed as all on fours, teeth in a day concept, very well promoted by many companies and dental tourism. We do provide all on 4 and all on 6 teeth in a day dental implants, but we do advocate that one has to be very careful and the cases have to be carefully selected. The last thing we want to do is rush these treatments or provide these treatments in a way that would not benefit you in the long run. So the treatment has to be planned for long-term benefit rather than short-term, immediate smile. These are surgical treatments. There is some form of trauma to the bone, and if failure occurs, that can result in further complications, making it much more difficult to have a normal life. Hence, we strongly advise to be very careful and find the right clinician who is well versed with these kind of treatments, and then discuss with them the treatment options and choose the right thing. Rushing into these treatments is not a good option. Another option, which is relatively simpler, is to have 2 dental implants and have dentures supported by them. So some patients would have lost their teeth over the years in the lower arch, lower teeth. Often the lower dentures will rock about. They tend to not hold their position. Some patients would struggle a lot with them. Upper dentures, patients are able to cope with them in upper full dentures, but in the lower full dentures, that's a big nuisance. It is strongly advocated by most of the dental institutes and colleges and WHO to have at least 2 dental implants in the lower arch. That allows you to have a denture which can be stable in the mouth and would not rotate or rock too much. And that is a very popular option for those patients who have lost all their teeth but are struggling with the lower denture and would like it to be supported by the dental implants. The dental implants essentially click in onto the dentures clicks onto the dental implant, and it works wonderfully well. patients who've had implant supported dentures or retained dentures have seen a major difference to their lifestyle. So what happens after loss of a tooth? The bone starts shrinking. We want to protect this bone, especially if it is already planned to have a dental implant. So to protect that bone, we often require bone graft procedures to be done. So what we do is we will open that area, lift the soft tissue gently, check the bone underneath, check for any defects or infection, and essentially clean that area. Then place bone graft. There are different type of bone graft materials that are available nowadays, and we allow that soft tissue and the bone graft to heal over 5 to 6 months. After that, we will open that side gently, normally much simpler procedure, and place an implant into the bone. Routinely, that will also require another few months for its healing process to complete before the final crown will come into place. Case to case, some implants can take 6 to 12 months for completion, unless teeth in a day or concept is considered, or we are able to address the bite and occlusion correctly.